Hello and welcome. This is Vicki with Vicki Talks. I think I have a very special program for us today. I'm going to be talking to a friend of mine and my insurance agent and a fellow Toastmaster and a fellow churchgoer about a serious thing that us as seniors face, and that is Medicare. When my husband, my late husband, got disabled about 12 or 13 years ago, I spent numerous hours researching Medicare to find out what was the best option for us. I went through pure torture trying to figure this out on my own, and I want to share with you some of the things to help you so you won't have to go through what I went through. So my friend today is J.D. Collier. Hey, J.D.
Hey, Vicki. Thanks for having me.
Yes, he's my personal insurance agent. First off, you need your own personal insurance agent. If you go to the 1-800 number, you may have good success and you may not. So I have my own agent. I'll share him with you if you would like. But anyway, J.D., I want to tell my viewers about how to find the right plan, how to keep up with the right plan, what is out there, and so on. So the first thing that I want to ask you is, what would be the first piece of advice that you would give us when looking into Medicare?
Well, when you're looking into Medicare and you want to choose a plan, you want to see what your needs are. That's the most important thing, is what do you need in a plan? What do you want your plan to do for you? So you look at, like when I meet somebody, I talk about the medication they take, what kind of health are they in, what kind of doctors they see, how often they go see a doctor, what's their budget. At that point, I have something in mind, and then I'll start presenting the different plans to them, and see kind of what they like, what fits their needs.
Right. Because from what I've found out, there are many insurance companies that provide Medicare supplement. You have to have some sort of supplement because Medicare only pays 80%, right?
That's correct.
Yes. So you have to have something, whether it be different types. I have an Advantage plan.
Yes.
Some people have a supplement. When I get older, if I make it to my 90s, which will be about 40 years from now, that's a joke. I will probably look into the supplement. But right now, I'm on the plan where I don't have to make a premium payment, but yet I have some out-of-pocket expense. So budget is very important, and your drugs are very important. But that's what I want my people to understand, my viewers to understand, that you need a plan. It could be from you, which you represent United Healthcare. It could be Humana, Blue Cross, MetLife. There are so many out there that provide this service. There's a lot of companies out there, and with your supplement plans, you have more companies that provide the supplement plans, and there's some companies out there I never heard of before. They're just a not rated plan. So that's one thing important too, is the company that you pick. With the supplement plan, you pay more to have them. Right. Premiums.
And premiums,
monthly
yes.
Premiums, yes.
But when you use them, you pay little or nothing, because they'll cover more as far as your hospital medical. And you'll have to get a drug plan with it, because they don't have a drug plan that goes with it. And it can be very expensive. And if you can afford it, it's a great way to go.
Right.
Now, what you got the Advantage plan, it's actually Medicare Part C.
Oh, okay.
And what it does, it combines your A, B, and D, and it gives you extra benefits that are beyond Medicare, like your vision, your dental, hearing.
That's good to know.
You know, our plans offer over-counter products and transportation and different things. And these plans, they have a low premium. So they cost little to have them or nothing, but a little more when you use them in co-pays.
Right.
And they do have what's called out-of-pocket match, which is a safety net. So if your co-pays for your hospital medical reaches that certain level, you don't pay nothing for the rest of the year. So you got that protection.
Right.
Where with just regular Medicare, you don't have that safety net. You got deductibles for your A and B, and you pay the 20%, and there's no ceiling.
Which is a lot. Can be a lot.
Well,
Yeah.
if you went in the hospital, you pay like a $1,364 deductible. When you get out of the hospital, if you got like a $50,000 hospital bill, which is not unrealistic.
That's gonna be one day.
Yeah, and there's $10,000. So you need that extra.
Right.
And it just depends on what you're looking for.
What your needs are, like you said.
And
your needs are.
Because if you look, so let's take the Advantage plan for example. If you look at United Healthcare's or Aetna's or any of these other companies, they're all structured kind of the same.
Right.
Medicare's got requirements.
Right.
The difference are the co-pays, the extra benefits they offer.
Even the premiums.
The premiums. And so that's where you kind of see what you want, what do you need. We have a plan that offers the personal emergency response system. And you can wear it around your neck.
Oh, the alert.
Yeah, the alert.
Help,
around your
I've fallen,
head.
I can't get up.
That's right. And it's good for around the house. It's good for around the yard. And it's at no cost with that plan.
My next door neighbor has that. It's $30 a month. It's her premium. Or $28 maybe.
Yes, that's right.
And the alert costs $30 a month. So it pays for itself just in that.
Right.
Now I don't get that. I have the zero premium.
Right.
I don't get that, but everything else is pretty much alike. But that's a good point, because that's one of the things that I found out when I was doing my research is all of the companies have to offer pretty much the same things according to the Medicare guidelines.
Right.
But it just depends on your budget, how much you can afford, and what you want to pay.
And the extra benefit.
So that's one of the things I want everybody to know, that you have to do your due diligence. And one of the things that happens that I want you to explain is every year at the end of the year, we get to review our medical plans and change. So, and that's called what? Annual enrollment
period. Yes, and that's October 15th to December 7th. Because every year, plans change a little. Medicare changes a little, and as agents, we really can't talk about those changes until after October, and we really don't know the full details. They give us a little sneak preview, but we don't know everything. So it's good to review your plans every year. It is, and see what your changes are. And that's where having an agent comes in, where you got somebody that kind of looks out for you. I try to send out, mailers every now and then to my members and let them know about plan changes and stuff like that. And then you got somebody you can call, ask questions.
Rather than the 800 number. You've helped me several times and you have to watch out with this, because I had a procedure. It's a standard procedure everybody over 50 has to have. We won't go into that. And after the procedure, I started getting bills from the doctor. I'm like, wait a minute, really? And I said, well, I guess I have to pay. It was $170. I was just going to give him $10 a month. So I happened to be talking to you one day, because like I said, we're friends, and we were probably at church or somewhere, and I told you about it, and you said, ho, 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 they're not supposed to bill you for that. So you got on the phone on my behalf, because if you have your own agent, you can do that.
That's correct.
And you got on the phone and found out that I was not supposed to pay that. So it could have been coded wrong, but you have helped me several times with things like that. And that's why I say we need our own agent. I've got a friend now that's having problems with her insurance not paying. I said, do you have an agent? She's like, no. I said, whoa, you need one. So anyway.
That's right, Vicki. That's very important. I'm an independent career agent for United Healthcare. So when somebody enrolls with me, that makes me their personal agent. I'm their agent on record. So if they have an issue or a question, and it's something that I had to call in my help desk, that's the first thing they're going to look. Are you agent on record?
Yeah.
Well, if I'm not, they're not going to give me any information.
Right.
But being that agent on record, then you got something.
Yeah, because there's always going to be something. Food pause, somebody's going to make a mistake. So it's really nice to have that instead of calling the 800 number.
Yes. Because sometimes, and I don't mean to knock customer service for any company, but you know, sometimes you get somebody that's awesome, and sometimes you get somebody that might be new.
Exactly, and they're learning at your expense.
Exactly.
But anyway, but here's another thing you mentioned a minute ago about prescription drugs, because most of us take prescription drugs. Although I have a friend that has a 92-year-old mother that only thing she takes is something for her hair and nails. She takes no prescription drugs. So when she signed up for Medicare, she didn't take the prescription part. And now she's penalized by the government. And we'll talk about it in a minute. Why don't we take a quick break and we'll be right back. Do not go away. This is Vicki Talks. Welcome back to Vicki Talks. I'm talking to J.D. Collier, my friend, my buddy. He is a United Healthcare agent, but we're talking about Medicare. And when we left you a minute ago, we were talking about the drug plan. And if you don't sign up for the drug plan when you're eligible, even though you don't pay for it maybe, you don't take drugs, you will be penalized. My friend's mother is 92 years old. She has to pay $16 a month forever because she failed to sign up for that.
That's true, Vicki, and it's a big problem, and they're getting better at educating seniors about this than used to. Nobody knew. And when I meet with people, I always stress that when you're in your initial enrollment period, turning 65, you got a 7-month window, 3 months before you turn 65, the month you turn 65, and 3 months after. That's when you can sign up for Part A and Medicare Part B. And that's when you can enroll into a drug plan and Advantage plan. Supplement plans are a little different. You can enroll in them pretty much any time, but you have like a larger window where you can sign up and have guaranteed acceptance at 65. But here's what happens. Medicare requires you to have a drug plan. So let's say you're in your initial enrollment period. Your initial enrollment period ends. They give you 63 days after that. Well, once it ends, you're kind of stuck unless your annual enrollment or something around the corner. But after that 63-day period, they'll start to penalize you 1% interest a month. You don't know it. You don't see it. But when you get that drug plan, they tack that penalty onto your premium. So the national average of a drug plan is $34 something cent. Let's just say $35. So if you go 12 months without a drug plan, they take 12% times that $35. Whatever that figure comes to, that's what they tack on to your premium. Now Medicare sets that rate, but that's the formulary. So technically I can't say, well, here's what it's going to be, but you know, you can figure it out yourself.
Yeah.
And
What?
I enrolled a lady, and she was in her 80s, and she had like a $30 a month premium added to her plan, and it was, you know, they were mad at me about it. I'm like, you know, I can't do nothing about it.
And that's why I want people to know the things that I found out and that I have seen. And also, there's a penalty if you don't sign up for Part A, which is hospital, is that right?
Yes.
When you turn 65 and you wait, because I was working when I turned 65, and I did sign up because I went to a class and they told us that, but if you wait until you're 70 and you retire, you get penalized a big chunk, right?
That's right. You got to have A.
And it's free.
Right.
There's no premium.
If you got a good work history, if you work 40 hours a week for 10 years, it's paid for. It does have a premium. It's like $430, something like that. But if you got a good work history, it's paid for. And of course, you are required to have Part B also.
Well, that's when you're not working anymore and you need it.
Right. You can delay it.
Or if you're on disability.
Exactly.
Because disability is, you get Medicare when you're on disability no matter how old you are.
Right.
So everybody needs to know that. But then in addition to the annual enrollment, which is October the 15th, that's when you need to change plans if you're going to, or if you like your plan, which I've been with you 2 or 3 years now, and every year the plan gets better. So I'm staying with JD. But there's also an open enrollment that comes out in January, February?
It's January 1st through March 31st.
And that's something new, right?
That is new. That kind of took the place of the disenrollment period. Where you could disenroll in your Advantage plan if you didn't like it and go back to original Medicare and get a drug plan. Open enrollment allows you to change your Advantage plan one time.
Okay. So if you signed up for, well, that's something new.
But
here's something else new, and I love your chart here. If you have Medicaid, in addition to Medicare A and B, you get additional benefits, right?
That's right. You get, you know, of course when you got Medicare, Medicaid, you get a lot, but there's plans out there and they're called dual plans, and they're designed for people with Medicare and Medicaid, and it gives you more benefits than what you get, which is Medicare and Medicaid. And there are benefits you're entitled to, but that's the way that you go about to get them.
Because nobody tells you this. It's like a veteran. VA doesn't tell you everything they're going to give you. You've got to look for it. You've got to investigate.
That's correct. That's correct.
I mean, you have to take control of your own self. They're not going to come knocking on your door and say, okay, so-and-so, let me tell you what all you can get. No.
That's right. And there's people, well, just like a while ago, I got a phone call, called a lady back. She's seen one of our plans and she's got Medicare, Medicaid. So I'm going to meet her tomorrow because she liked what it is. And people who are aware of it, they'll contact you because they want it.
Yeah. And this is advertised on TV. That's where I first saw this and asked you about it. I'm not on Medicaid, but I thought it was good.
And you know, there's some people that's just scared to make that change. They don't want to change anything, but
now you can change it back if you don't like
you're right. You're not losing anything. You still got your Medicare, you still got your Medicaid. You're just combining them together into this plan and getting the extra benefits out of it. You're getting a network of doctors, and you're getting, you know, the vision, dental, over-the-counter product, more transportation. It's just your drug plan. It's just a list of extra benefits you can get.
Yeah, and it's getting better. Now they have dental and vision.
That's
It
right.
might be a little extra to pay for that premium, but it's something that we as seniors need because our eyes are going bad, our teeth are rotting out, so we really need that.
Right.
So it's really good to know that we're getting all that. Yeah, yeah.
It
yeah.
is. And another point is, you have the zero premium plan, but you're a healthy gal.
Mm-hmm. Because I'm only 40. I'm
Right, that's
yeah.
right. I don't even know
I don't even know how I got Medicare.
Really. I can't figure that one out.
I know, me too.
But, if you look at your situation, a lot of times, like that, I'm just going to use we got a zero premium plan, we got a $28 plan. That $28 plan annually will save you more money when you're using the benefits that it gives you versus a zero plan. Under certain situations, you're the doctors, your conditions, what you use in it. So it's a lot of people, they say, well, I don't want to pay nothing, but you're like, well, in your situation, you should have this plan.
And it'll pay for itself in the security alert thing.
Right. Just the monitoring.
Yeah. Anybody that's
costs you get.
unstable or lives by themselves, that's a great thing to have. So that pays for itself right there.
Because that's a $300+ value a year.
Yeah,
And then the over-the-counter products, that's another.
And what you're talking about is I get $40 a quarter of free over-the-counter products. My friend who has the $28 plan, she gets $60 a quarter. You just order, it comes to your door, it's free of charge, all kinds of medical stuff. Yeah.
That's
She even gets some stuff for her diabetes. I don't know if it's the Lancets or what it is, but that helps her a lot.
It's a good value to have.
Yeah. And from what he's told me, it's going to get better next year. He won't tell me what, but he just says it's going to get better.
I can't say for another month. Another month I can show it to you, but I don't even have it now.
Exactly. So I can't wait to see how much.
I can just say there's some positive changes.
Yeah, but I hope above hope that all of my viewers have seen a little bit. And if you don't need it yourself, you can share it with your parents or your kinfolk or your friends and let them know a little bit more about Medicare. I mean, it's a good program, but it's very complicated when you don't know what's going on. I mean, it's just complicated. There's so much out there. And when I signed up the first time for my husband, when he went on disability, I got a plan that was fairly new. Well, they only had 1,000 providers in the entire state of North Carolina. Well, guess what? 1,000's not many. So I found out after that I needed somebody else because he was going to have to change all of his doctors. So, and the lady on the phone said, well, you can't change once you've signed up. And then I talked to another guy and he said, oh, yes, you can if you do it before December 7th. You can change. So you need to know that too. If you sign up for one October 15th and you find out you found something better, the last company you signed out with for December 7th is the one that you get to go with.
That's right.
So see, that was an 800 number and I got the wrong information. So you need an agent.
That's correct. Yeah. Annual enrollment. You can change as many times you want, but whatever you're in at the end, that's the one you got.
So that was a good learning lesson for me, and hopefully it'll help you guys too. So tell me, we've talked about Medicare. So you've been an agent what, 5 or 6 years?
I've been an agent about going on 6 years. I started out in the call center. And then, I worked at a call center for United Healthcare over in Concord. And then I got the opportunity to become a field agent.
Wow.
And the call center was a good job, but you
learned a lot.
I got excellent training. I got my license. But sitting there in front of that computer all day was absolutely, it was killing me because you know, I used to be a brick mason.
That's what I wanted you to tell them. Yeah.
And I had a company for 28 years and I really enjoyed it. I enjoyed it. It killed me physically.
Well, yeah, I see your hand is bandaged up.
Surgery number 7 since 2010.
You had foot surgery last year.
That's right.
And your body's just falling apart.
My joints are shot. And if I knew what I knew now, I would have never done it. I love my job helping people with Medicare, and to me it's not like a job.
Exactly.
Because I get to help people.
Yes, 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 and we need it.
Yes, yes.
Because when you get 65, we're already, and then this complicated Medicare, like, oh, help me, help me, help me, and that's how you've helped me so much. Is there anything else you want to tell the viewers about the ins and outs of Medicare? We got a couple of minutes left.
Well, let me think a minute.
Something they really need to know.
One thing that I like to stress, because I run into people who just have original Medicare and a drug plan, and they're confused or they're misled by family members. Mm-hmm. And if you just got regular Medicare, original Medicare and a drug plan, you really should get an Advantage plan.
At least, yes.
And the biggest point is that hospital protection. And then you got your drug plan in, and you get all the extra benefits. Because here's what happens with Part A: you go in the hospital, you got a $1,364 deductible when you walk in the door, and that deductible is only good for like 60 days. So if you go back in the hospital, 3 months later, you got to pay it again, plus the 20%.
So your Advantage plan or supplement will help you with that deductible.
Right.
Okay.
You just pay a co-pay for a certain amount of days, and that's it.
Okay. Wow. Good advice to close out on. Thank you so much, JD, for being here.
Well, thanks for having me, Vicki.
All righty. And we will see you next time on Vicki Talks with another exciting program. See ya.